Hello, I'm Dr. Inman. This is a miniature lecture on alopecia, or lack of hair, in the canine, feline, and equine. The lack of hair, or hair dropping out, can be actually accelerated by a number of different events. Pyoderma is one of them, which we've discussed in another video. But the regeneration of hair can be due to a hormonal imbalance, such as hypothyroidism or Cushing's disease. And those animals, those disease conditions have to be addressed. Those are also indicated in other videos that we have in this series. Hypothyroidism, Cushing's disease, Addison's disease, even diabetes mellitus as endocrine disease, and we handle that with a frequency-specific laser therapy. It's a bit ironic for me to discuss about alopecia when I'm sitting here with pattern baldness in my own self, essentially due to my grandfather's genes, but the point is, when we see an animal that's lacking hair like this, essentially, we want to treat the underlying problem, and then we can also stimulate the follicle of the actual gland, essentially, of the skin gland, essentially, to try to regenerate hair, which can be particularly effective. Remember, the underlying cause of alopecia like this has to be directed towards and addressed before we can induce the hair to come back necessarily. We utilize that technique here not by treating the hair follicle specifically, but by treating the blood supply to the hair follicle specifically, and we'll use a frequency set such as 363 for the skin, 300 for the capillary supply to the follicle. We'll also treat with 100 for arterial and 4 for venous supply. We also may want to treat with 230 for lymphatic drainage. And those frequencies very commonly can be an accelerant to the actual follicle to regenerate hair. So inside of a couple of weeks we have hair follicles erupting hair. Inside of a couple of months we have the hair back reasonably well to where we have a furry creature. It's interesting to note that when we use this technique, sometimes we get back undercoats or down type hairs first before we get guard hairs coming out. The guard hairs can in fact come out, but they come out slower when we're treating alopecia. Alopecia basically then is an effect of an underlying disease process, and we can treat it as a separate process by itself. But if it is not going to be effective, this therapy I've just shown you is not effective, it's because we've not addressed the underlying problem that's causing the alopecia in the first place, which very commonly could be endocrine disease or chronic allergic dermatitis, which we talk about in several other videos that we have. Thank you for looking at this. I'd have you, if you have any more information or any more questions about looking into alopecia and treating it with a frequency-specific low-level laser therapy, I would have you go to the vomtech.com website, which is indicated here, and also look under frequency-specific low-level laser therapy or cold laser therapy, and we'll give you a lot more information on how the technology works. I'm Dr. Inman. This has been a lecture on frequency-specific low-level laser therapy, essentially, and also on treating alopecia. Thank you, and have a great day.